9:42 now. Sexual health can be a taboo topic, even more so amongst Latinos. Experts say that, plus language barriers, amongst other factors, are part of the reason why they are some of the most affected by HIV and STIs.
And West 2's Jesse Pagana introduces us to one Central Florida group trying to change that, taking education and resources to people in their language.
This is the sacristy of the church.
In the back rooms of a church in Azalea Park.
And this is the space where we can see our patients and we can provide HIV testing.
In this space, people in need can get tested for HIV, get medications, and get linked with resources for free. And while it's open to all in need, Aguilar Salud is laser focused on Latinos.
There's a lack of language justice. We don't have as many services in Spanish, and that's why we find important to address our community with 100% Spanish-speaking resources.
Some of the latest data from the CDC shows Hispanics and Latinos made up 33% of the almost 32,000 new HIV infections in the U.S. in 2022. Overall, as of 2022, an estimated 1.2 million people in the U.S. had HIV. That CDC data shows almost 317,000 were Hispanic and Latino.
I'm a person living with HIV, and I'm a Venezuelan immigrant. I'm a gay man.
Jose's lived experience is what sparked him to create Aguilar Salud in 2022, which has now expanded to Claremont. And it's what motivated case manager Dariagna Colina to join him.
No se habla, en la casa no se habla de eso, and that's it.
It's a common phrase, meaning, in this house, we don't talk about that. Dariagna flips that on its head, educating people who call for help and doing it in their language.
Most of the times when they hear me speaking Spanish and they also see that I can speak to them, I can also connect with them.
It's also why several of the nonprofit's programs get their names from catchy buzzwords. PAPI is their main prevention program, and Quiérete Chica focuses on women's health.
Connecting Latinos with these resources is very important.
The language connection is how the team got to Pedro Ayala. He first learned of Aguilar Salud at an event, then used one of their services. Now, he volunteers for them.
¿Por qué decidiste tú, Pedro, involucrarte con Aguilar Salud y este servicio de VIH y salud?
Bueno, mi primer contacto que te digo, la cena, que es un evento que hace Aguilar Salud, me encantó como ese espacio de integración de personas.
He says the inclusion of people is what he loved, and that is Aguilar's end goal.
Why do you do this? Why do you take this on?
I think this is a mission, and this is my purpose in life. This wakes me up every day. I'm being honest. Also, we can end the HIV and we can address healthcare disparities. I'm going to be doing this from the bottom of my heart.
In Orange and Lake County, Jesse Pagan, WESH 2 News.
Awesome. And Jose says the funding here comes from some grants and private organizations. They also help getting people food and clothing and even transportation for those medical appointments. We have much more information about how you can get in touch by going to our website, wesh.com.